the next paper. I'll invite Q. Mondal for his paper Neutrophil lymphocyte ratio and platelet lymphocyte ratio in retinal vein occlusion.
Good morning. Neutrophil lymphocyte ratio and platelet lymphocyte ratio in retinal vein occlusion. It is the second most common retinal vascular disease following diabetic retinopathy. If it is not treated, it may lead to loss of vision due to macular edema and retinal ischemia. It can be subdivided into BRVO and CRVO. There are many risk factors like hypertension, diabetes, hyperlipidemia, etc. Pathogenesis is multifactorial and believed to follow the principle of virtuous triad consisting of venous stasis, vessel wall injury, hypercoagulability. Inflammatory process play a critical role in development of macular edema, and neutrophil lymphocyte ratio indicate the balance of neutrophil with lymphocyte, and platelet play a crucial role in the pathogenesis of thrombo-occlusive disease. PLR indicate the balance of platelet with lymphocyte. NLR and PLR calculated from hemogram and emerging hematological inflammatory biomarker indicative of systemic inflammation. Their association with diseases like some cancer, diabetes, cardiovascular diseases, atherosclerosis has been well documented. And currently few studies in the literature have documented in the association of NLR and PLR with RVO with no studies published from India. This is my research question. Aims of the study is to find possible association of NLR and PLR values in patient diagnosed with RVO as compared to age and sex match control. It is a hospital-based cross-sectional study. Study duration was 18 months. Total sample size was 76, case was 38 and control was 38. This is my inclusion and exclusion criteria. Exclusion criteria was pre-existing documented systemic inflammatory diseases, documented blood dyscrasia, patient currently using OCP, anticoagulant, anti-inflammatory, pre-existing glaucoma and globe injury. Result, mean age in study group was 55.18 years and in control group 55.15 years, and 42.1% was CRVO group and 57.9% was BRVO group. Best corrected visual acuity in study group 48.82 ETDRS letter and in control group 80.66 ETDRS letter. And this is baseline characteristics of study participant. And this is the main study variable NLR. In study group NLR was 2.18 mean and in control group mean NLR was 1.83. There was in study group there was much more mean NLR, but this is not statistically significant. And in PLR group, PLR in study group 1182 and 101 in control group, and it is not statistically significant difference. And this is the laboratory finding of study participant, and between NLR and PLR there was no statistical significant association, but in retinal vein occlusion group NLR and PLR value was higher. And from ROC curve, NLR and PLR are not good indicator to predict retinal vein occlusion. And discussion, the pathogenesis of RVO is complicated and multifactorial. Traditionally, the pathogenesis of RVO has been thought to follow virtuous triad, and thrombosis and inflammatory process are central to mechanism underlying retinal vein occlusion. And NLR and PLR serve as valuable inflammatory marker in disease associated with thrombosis and inflammation. And Darson et al. And Atom et al. Showing a significant difference between NLR and PLR in RVO, but Kamral et al. And Pina et al. They showed no statistical significant difference between retinal vein occlusion group and control group. And our study also found NLR and PLR were not significantly different between RVO group and control group. And based on our finding, we recommend that future research in this area explore a broader range of inflammatory marker and risk factor for retinal vein occlusion. And our study did not find a significant association between NLR and PLR and RVO, as RVO remains a sight-threatening condition with significant global impact. Further research is warranted to reveal its complexity and identify more reliable predictive marker to improve its management and outcome. This is my reference. Thank you.
Thank you so much.